Thanks, Mr. Chairman, and thanks to the witnesses for coming here today. We must take the dangerous, deadly threat of Ebola as seriously as we take ISIS. Let me say that again. We must take the dangerous, deadly threat of the Ebola epidemic as seriously as we take ISIS. I think I have a reputation as a senator who's not given to overstatement. I don't believe that's an overstatement. The spread of this disease deserves a more urgent response from our country and other countries around the world than it's now getting. This is one of the most explosive, deadly epidemics in modern time if we do not do what we know how to do to control it. It will require a huge and immediate response. There's no known cure. There's no vaccine. Half of those who get sick die. Each sick person, according to the Center for Diseases and Control, could infect 20 or more others, including caregivers, friends, and family. Samantha Powers, the UN ambassador, said to me earlier this week in a briefing, she's trying to get other countries to view this with the same urgency that we do. This is an instance, she said, when we should be running toward the burning flames with our fireproof suits on. Ebola is killing people in West Africa at alarming rates and picking up speed. It's hard to say exactly what the number of cases is. There is an official number, a little less than 5,000 of Ebola cases in Guinea, Liberia, Sierra Leone. But the worry is that 1/2 of those cases were reported in the last 3 weeks. You don't have to know very much about mathematics to know that if, whatever the number, if it doubles every 3 weeks, that very soon we have an out-of-control epidemic. And we can see easily what would happen if a single infected traveler reaches another country and begins to infect others in that country. I said earlier, and we'll learn more today about what we know how to do. We'll hear from a doctor who has contracted Ebola and who has recovered from it and who is here to talk about it. It's not like the flu. It can only be spread by bodily fluids, often contracted by caring for someone who's sick or through burial practices. But with global travel, we're only one airplane ride away from a person exposed to Ebola getting on a plane to the United States and then becoming sick once they arrive. And then the mathematics of that infection could begin to develop in this country. There's human tragedy in Africa, but it affects the rest of the world, and it affects the United States. Our state is known as the volunteer state, and Dr. Brantley, who will testify here, is an Ebola patient. He was working for Samaritan's Purse. He's not a Tennessean, but his parents are graduates of Lipscomb University, which is in Nashville. He, like many Americans, go on mission trips around the world to help people who need help. I will support the administration's request for the $30 million Senator Harkin talked about, for the $58 million for the biomedical advanced research and development. That's for vaccines and cures and treatments. That should pass this week. There's a request to address $500 million of reprogramming in the Defense Department. Some have asked, why should our military be involved? Because they have to be involved if we want to deal with the problem. There's no way for the doctors and the nurses and the healthcare workers to deal with it. So I'm pleased that on both sides of the aisle we have leaders who are beginning to recognize the severity of this epidemic. Dr. Frieden, United Nations Ambassador Powers are taking the lead. We look forward to learning all we can about the severity of the epidemic and what we must do to control it. But I'll end where I started. We must take the deadly, dangerous threat of the Ebola epidemic as seriously as we take ISIS.